Welcome to the LowCarbUSA podcast, where we seek to inspire you to help us build this community. I'm Doug Reynolds.
And this is Pam Devine.
So, Jodi, you were an attendee at our event in San Diego last year. You're based in Hawaii. And from what I've heard, you have a really progressive model, practitioner model, or practice model that you guys are developing and using there in Hawaii. So I'd love you to tell us all about that, but maybe start out by explaining how you got into this in the first place, and then sort of how that's developed into the practice model that you've got now.
Sure. So about 3 years ago, my dad actually had a massive heart attack and almost died. And I'm friends with the dietitian and neurologist at Shriners Hospital for Children here in Hawaii. And, they've been using keto for years on their pediatric patients to treat autism, epilepsy, and ADHD. Well, they told me after hearing about my dad's heart attack, you might want to look into keto and put him on keto. And I said, what's a keto? And knowing me, they said, research it. And that's all they said. And sure enough, like the rest of you, I just went down this rabbit hole of research. And I was realizing, holy cow, we're doing everything wrong in healthcare. So I said, Dad, you're going to do this. I'm going to do it with you so that we can be accountability partners so we can get your health fixed. He said, sure. Well, so we're doing it. And, I used to suffer with a very severe form of psoriatic arthritis, where I used to have to inject myself in the abdomen twice a week just to keep it at bay. And after 6 months of doing keto, I realized that my arthritis had completely gone into remission and I didn't need to do my injections anymore. And that was my personal experience with how keto truly reverses inflammation at all levels. After I did it for a year, I started talking about it on social media, just kind of sharing what I learned and how to do it with my friends and family. And my audience grew like drastically. People started saying, you need to teach keto to others. And I realized I need to open a medical practice, because if I don't do this and teach other healthcare providers and patients how to do this correctly, and thankfully you guys offered the certification course through the Nutrition Network, so I was able to do that and feel comfortable with moving forward. It all just started there. And every day our practice grows. We're getting more and more referrals from other physicians in the community. An endocrinologist locally just sent one patient to us today, and we're really excited about that because she's on the board for the American Diabetes Association here. So that was a huge win. And that was how I got started in keto, was because of my dad's heart attack.
Wow.
Okay, so now you're developing this practice. So tell us a bit more about how this practice works and where you see it going, because it's kind of innovative.
Yeah. Well, so I'm not an MD, I'm a Pharm D, a doctor of pharmacy. And in most states, we can't bill insurance for our services. And so luckily, a gastroenterologist in the community heard about me and what I was doing, brought me into his office and said, I need you in my office. How do we make this work? So I said, well, we've got to figure out the billing part. And so we approached our Blue Cross Blue Shield plan. I told them exactly what I wanted to do. The VPs just so happened to be big believers in the ketogenic lifestyle and said, we want to support you. We want to make sure that this works. You've got to partner up with him so he can do all your billing for you. And it's completely legal. These are the codes you guys are going to use. So we created a MD Pharm D care model in our practice. And right now it's GI physician, Pharm D. We are very close to hiring a nurse practitioner so that we can see other conditions as well, because we're seeing them anyway, but get it covered by insurance for the patients. He sees them for all the GI stuff, then he refers them to Dr. Jodi, that's me, for keto. And I teach them everything they need to know about keto, how to do it correctly, tailored to their medications and their medical conditions. And I do all of the medication management. And the doctors feel very comfortable with this care model because we are the experts in medications. So I'm able to safely and carefully titrate them off or down on their medications in a way that's very comfortable with all of the primary care docs in the community. So with this model, the acceptance rate for keto done correctly is really growing by leaps and bounds every week and every month because of the Pharm D care model, which is kind of unique. It's in pockets around the nation, but our Blue Cross Blue Shield plan is closely watching what we're doing. I'm actually meeting with another payer here locally next week for lunch. They want to get a better understanding of what we're doing in here so that they can figure out how I'm going to help all of their employer groups, the blue collar workers, all these guys that eat so unhealthy for lunch. How can I get in front of them and teach them how to tweak their eating to lower diabetes, lower heart attacks, and all of that? And we are also the pilot project for a national pharmacist group that people don't realize. A lot of community pharmacies are closing down and going out of business because the giants are taking over, CVS and Walgreens primarily. And this is a problem because what those companies do is they count pills by fives, they get you out, and they're a factory. There's no patient care that's happening. So we've got to create jobs for pharmacists that are outside of the pharmacy. And that's one of the things that I'm trying to do. Yeah.
As all of these things get in place, I think the support for people trying to do this is going to get better and better.
Oh, totally. Yeah. Well, and mine is a stepwise approach because, insurance kind of limits the visit to maybe 20 to 30 minutes each time.
Right.
So what I do is first visit is I take what's called a very comprehensive food history, and then what I do is I put them on a 2-week weaning them off of sugar plan while we supplement their electrolytes naturally with food.
Right.
And then the second visit is when I start to introduce all of the healthy fats and help them basically just build their plate. So we do this whole stepwise program with them, and it works really well. Yeah, and you've got to take cultural things into consideration. I mean, that's why I do a whole comprehensive food history. I mean, I find out how many parties are you going to on the weekends, because that can be a cultural thing too. Yeah. And you've got to incorporate all of that if you truly want it to work for the patient, and especially with their medications. There's so many medications out there where when you incorporate this type of change in their eating, you've got to almost instantly cut back on their dose by 50%.
Yeah.
And then you've got to bring them in every so often to monitor blood sugar, blood pressure, all of these different things. And so that's where we really, I think, run into problems with what I call social media keto, is they don't talk about that. None of those people are qualified to do that. So that's why the Pharm D care model that we're using is really being watched so closely by some important groups, is because really MDs have no training in pharmacology, whereas we have 4 years of it. So why wouldn't you partner up? Why wouldn't you team up? I mean, we've got the double whammy. We could be doing this kind of successfully without keto, but now you throw keto in there. And I mean, it's like the ideal treatment approach for so many things, almost everything.
Okay, so Jodi, I know we've talked about how you're successfully implementing this program into your medical practice and how the success that you're having in planning. And you were telling us about what you're doing. You work 4 days in the office with patients, and then 1 day a week on the 5th day, you go out into the community and you're working with companies and organizations that will make this lifestyle more sustainable for people when they're out eating out and doing things like that. Tell us a little bit more about that. It's really exciting.
Yeah, absolutely. And what's funny is it was our Blue Cross Blue Shield plan out here that charged me with, make this sustainable and we will back you up as much as you need us to. And so that was how that whole thing started. So I dedicate 1 day a week to going out and about in the community. And some of the things that I do is I do a lot of menu consulting, restaurant consulting. More and more businesses out here are warming up to the idea of having a keto section in all of their menus. So one of the first big projects I took on was we created Hawaii's first keto approved food court. And it's right in Honolulu. It's like 5 minutes outside of Waikiki. And we've got 19 food vendors in this indoor marketplace that have anywhere from 3 to 5 keto approved items by Dr. Jodi on their menu. And this is such a great one-stop shop for everyone that does keto. It's free parking. You've got all different ethnicities of food. It's just amazing. And all their ingredients have been checked and vetted out by me. And so that was the first really great project. Second, I mean, I'm pretty proud of this, is 7-Eleven Hawaii decided to make a keto section in all 67 locations in our state. So you're talking multiple islands. And what I thought was going to be like maybe 10 items in each store, like a little key, it's actually going to be anywhere from 40 to 50. So this is huge. And again, it's endorsed by the Keto Prescription, which is my company name. It's going to have my logo. They're going to do a ton of advertising in the local newspaper around this initiative, because what they're realizing is that they need to get on the healthy bandwagon. And they could have chosen to go vegetarian, vegan, paleo, but they chose to go keto, which I thought was incredible. So they hired me to keto coach their entire marketing team and their VPs and the head of each food department. And I believe the launch of this is going to be in April of this year. So that's exciting. And we're going to do everything we can, to make sure it goes well. You know, their market typically is all of the blue collar workers and a lot of students before and after school. So to me, those are very important demographics for us to hit in the community. But also, we're going to be bringing in an entirely new demographic to 7-Eleven that doesn't typically stop there because they can't find anything to eat currently. Right?
So when now they see the advertising and they know about it, we get more people eating keto and 7-Eleven score. So I mean, what I'm really excited about here is that this is initially statewide within Hawaii,
Yes.
but 7-Eleven is a national brand, right?
International.
It's global.
Okay, so I didn't even realize that they went beyond beyond the boundaries of the US. So that's even more exciting, because when this takes off, it has to expand to all the other 7-Elevens. I mean, they don't operate in a vacuum within the corporation. So without us even doing anything to proliferate that, it will expand into all the other states and worldwide, which is incredible.
It'll definitely.
And everything's going to be approved by Dr. Jodi, so you'll be famous.
Yeah, well, I just, again, the goal is we've got to show, right? Everyone says keto is hard. I can't do keto. My doctor said not to do keto, which you and I both know is completely false. And so this was a huge opportunity that I would have been a fool to turn down, to show the world and the US that this is, to me, if 7-Eleven can do it, all of you can do it,
Yeah,
totally. So, they do work with a company from Japan to make all of their hot food here in Hawaii. And I think the goal is to offer at least 2 to 3 hot items, beef up their salad selection. And then, of course, all the things that are currently in the store that we can put in one section that are keto-friendly, keto-approved. So if you're doing keto or you have diabetes or whatever, you're just going to walk straight to that area of the store and everything in there is A-okay. That's the goal. And again, this won't be launching until sometime in April. So it's not out yet. And then we got to cross our fingers that it goes well, because if it doesn't, then they could pull it, so I've got to make sure this succeeds, because it's not just about Hawaii. Like you guys said, it's the whole U.S. Because all the 7-Eleven heads for each state, they all talk. And if this,
that's what I'm saying. It's like, when this is really successful, which I totally believe it will be,
Mm-hmm.
The Hawaii ones do not work in a vacuum, and that all the other 7-Eleven
Right.
states are going to hear about it, and then worldwide as well. It's going to be brilliant.
How do people get a hold of you? I don't know, what are your preferred social media, website, or anything like that?
Yeah. I think the easiest thing is my website is theketoprescription.com. That's the same as my Instagram handle at the Keto Prescription. And the best information is on Facebook for me, which is under Jodi, Jodi, Nishida, Nishida. Because I do longer videos and stuff on Facebook.
So a bit of a spoiler alert. Maybe in April next year, we can come and see how that's working, because you heard it here first, as we're most likely going to be doing an event with you in Hawaii April next year. And we'll get you on to do another one once it's all set up and it's up and running and it's published. We'll get you on again to talk about that and get some excitement going about that, because that's going to be a lot of fun.
Oh yeah, that's going to be great. Yep, heard it here first. April 2021.
Yeah.
Yay, so exciting.
Yeah, thank you so much for being on, taking the time to do this, and we'll speak with you soon.
Sounds good. Thanks for having me on.
Hey, bye-bye. You've been listening to an episode of the LowCarbUSA podcast. You can support us on Patreon at patreon.com/LowCarbUSA.